We do have a wonderful next speaker. And first, I wanted to thank Dr. Giorgio for her presentation. Much, much appreciated. And again, we look forward to working together in the future. I did want to introduce Christopher Ciano, who is the president of Aetna Medicare, the CVS Health company now. So I do want to say that Aetna CVS Health has been a valued ally of Better Medicare Alliance. They were one of the founders and a funder. And so thank you for the partnership that we've had now for well over 5 years. You really had a great idea and had a great idea in the beginning, and I'm happy to make it operationalized. But we want to talk today with Chris about how his team is working on Medicare Advantage, some of the exciting work he's doing, particularly during COVID. But in particular, we wanted to focus on social isolation. So Chris, welcome. And let's just jump right in. We are going to, again, we could talk about many things. You just heard from the previous panel about all the things that Medicare Advantage is doing, and Aetna is certainly very much a part of that, providing coverage and care in such innovative ways for millions of Medicare Advantage beneficiaries. So thank you for that and for your leadership. But we wanted to focus this conversation on the issue of social isolation. It seems that social isolation is something that's been around for a while, but it's almost newly recognized as critically important, particularly for seniors, seniors who are isolated, the age, and really having an impact on their mental health and their physical well-being as well. So it's brought a lot more. COVID has done a lot of terrible things, but it has brought attention to this issue for seniors. And so I wanted you to begin by talking about how you see social isolation, how you see it fitting into the medical care that you provide. And I know that you have a personal story. So if you want to share your own experience as a caregiver, that would be great too.
That'd be great. Yeah, I mean, first off, Congresswoman, it's so good to be here. This is such a critical topic. It's also personal to me, as you mentioned, as I'm the caregiver to my 93-year-old parents. But when you think about social isolation or social connection, the opposite of it, it's such a critical factor of health. And specifically, as we think about seniors, COVID, as you mentioned, has accelerated it. But ironically, you know, as individuals age, social isolation and the risks of it progress as people get older. And clearly, COVID has really shined the light on this. You know, many of our seniors live alone. They depend on others. And for basic needs, meals, transportation, finances, all those elements can become, you know, extremely challenging during a period of a pandemic. It sort of becomes on steroids. And we've asked, you know, all our seniors across the country to, you know, socially distance. Many of them have been held up in their homes and in their apartments. And it's just really put tremendous stress on this factor. And when you think about when we've looked at it, even before the pandemic, medical research has shown that, you know, it can create depression, stroke, heart attack, you know, put stress on the immune system. So being isolated and not being connected to others is really a significant clinical issue. And it's become even more as a behavioral health issue. We've seen huge utilization during the pandemic as well. When you really think about Medicare Advantage plans, we have the opportunity to kind of rethink how we might approach and engage our members. And the pandemic has taught us that, right? Technology has kind of come to the forefront, which was a little bit of a surprise. When you think about tools like telehealth, right, which has become prominent now in 2020, and video calls and Facebook for seniors who have sought ways to stay connected to their families. So I've actually seen it firsthand. Both of my parents are 93. They're in an independent assisted living facility. They've been here in Florida. They've been locked up kind of in their apartments since March. I've seen a huge decline in my mother's health just from being isolated, and really been trying to find ways for us to stay connected with them. Finally introduced technology, and you know, that's actually making a difference. My mother actually enjoys seeing her grandkids. So it's a serious issue that we all need to sort of be responsible for.
Right. Well, I appreciate that. And I have to say, I have my parents are both deceased, but my mother-in-law is 93 also, turns 94 in just a couple of weeks, and she lives independently. She lives in an apartment, and fortunately just moved to Philadelphia area so she can be near us and happened just before COVID. And she's really remarkable and able to really handle herself. But it's pretty hard to move to a new community and,
Right.
not be allowed out anywhere. But she's very fortunate that she has family around and is able to see family at a distance, but see us and see her grandchildren and see great grandchildren now, little ones that she can say, oh, I can't believe that I'm actually getting to see them and be with them. But you're right. She actually engaged. We could never convince her to use technology until COVID. When we finally said, we're buying you an iPad, you don't have to use it for any other purpose than seeing your grandchildren. and it took her a while to sort of engage with it, but now she feels it's kind of a miracle in her life, which is just great.
It is great.
It is great. But that said, your point is well taken, is a tough time for people who are living alone. And certainly if they have health conditions as well, or even if they didn't before, to really cope with this very by yourself kind of experience. And if you're alone, it's more difficult. So a couple of questions. Tell us a little bit more about what you actually do for them. What do you do to engage them? As telehealth, telehealth's a piece of that. But how do you identify who's in need, and how do you reach out?
Yeah, actually, even pre the pandemic, Aetna Medicare had a program called social connectedness. It was a part of our clinical strategy. And it really takes sort of a population health approach to trying to improve the holistic well-being of our members, right? Body, mind, and spirit. And we launched this actually in November of 19. And basically it had two components, identification, right? And intervention. So we've used sort of an algorithm, right? With a lot of information and data that we've collected on our members to really try to stratify those members that are at the most risk for social isolation, ironically. And then really, once we know those members, then we began sort of this identification and intervention phase. And so we have a group called our Resources for Living group. Many of them are social workers, and they started to make outbound calls to these members. And those calls started to open up a wealth of learning, right? And what the Resources for Living group can do is actually connect seniors to local resources that are in their community, even during the pandemic, that had to shift the way they provided elements, whether it's transportation, meals, financial counseling, the full gamut, right? And really started connecting seniors to these resources and helping them sort of begin to be engaged and avoid being at risk of growing in isolation. Technology has become, like we just mentioned, a lot of education on technology and resources to reference, how could seniors use technology and kind of get over that fear or that hurdle. And the great thing that CMS is allowing us to do is, as plans now, Congresswoman, is offer some of these supplemental benefits, right, that give us greater flexibility for specific conditions of a member to provide a certain level of service that we weren't able to do before. So, we've got a benefit called the companionship benefit that basically provides seniors with X hours a month, and they're using this. We've partnered with a company called Papa Inc. And they match up college-age students to seniors. And what has come about during the pandemic is a huge amount of phone-based companionship and a lot of technology lessons that we never really thought initially that we would use through the benefit. So, it is about an ongoing outreach. We've made hundreds of thousands of calls. The stories coming out of these calls and how we've been able to help seniors get food who are afraid to get out of their home. We've had food delivered. We've found people to bring them groceries. It's been quite rewarding.
Actually, that's great. You mentioned a couple of things that I think are sort of, behind the scenes that are really making a huge difference in what you do. You talked about risk stratification. We heard from many of the plans and providers that the ability and the fact that it was already built into the model of Medicare Advantage to identify people by risk. Not everyone sort of understands that term, but really identifying risk in a population, and then really being able to have that list of people to say, this is who's most in need. Let's go and offer them services. It's a really very different model than fee for service, and really recognizes that it's a whole person that you're looking at, and other things can affect them. But it is that ability to identify risk, keep that list. But then use it the way you have been. So it's It's great. What's your expectation going forward as to how much this will expand? Are you keeping track of how much it really is making an impact on health status and well-being? I know that when social service providers come to us at BMA and say, how can we interact with the plans? I always tell them they've got to keep statistics. They've got to keep some record. What does this really matter? Does it keep people healthier? What are your data points on this? So
Right.
I'm assuming you're keeping that as well, because it's important to, we don't want to share secret sauce here of the company and all that, but it certainly is a question of how can we amplify what's really working, so that
Yeah.
it can expand within Aetna, so it can expand obviously across the country.
I think as CMS has allowed us greater, and hopefully will continue to iterate and innovate,
Mhm.
it's really helped a lot. And we are using statistics and information, engagement levels, beneficiary satisfaction,
Mhm.
beneficiary clinical indicators that might be moving or changing as critical elements when you think about it holistically. But even in this resource for living model, we've seen, 61% of the members engaged that we targeted. That number is
Wow.
extremely high.
Very high.
We've been able to refer additional members into care management, and then giving our nurses and clinicians greater flexibility to provide resources that they normally would be very rigid and wouldn't be able to do. It's probably been the biggest benefit of this, because we're treating the person holistically as an individual and not as a bucket, and that we can only do A, B, and C. So a lot of learnings. Telehealth, I think, clearly is here to stay. I mean, we embedded telehealth in all our 2021 benefits, for example. So every Medicare member in Aetna will have a telehealth benefit now. That's kind of come quickly over 2 years with CMS. It was really only rural. Now we've got it kind of full force. So I think, we'll keep learning, Congresswoman.
Which is great. And talk a little bit more about those social supports and the supplemental benefits, because we are seeing also just a real growth in the use of these supplemental benefits. Of course, the ones that are associated with social determinants of health, the SSPCI, ones with the chronically ill, is just beginning, really. It started in 2020, but growing, of course, in 2021.
Yeah.
We haven't quite gotten the information yet about all that's being offered, but we are seeing increased use of supplemental benefits by Medicare Advantage plans, and that ability to save dollars, and to reuse those dollars for beneficiaries in this way is a learning experience, and I think one that is turning out to be really important to people's health and well-being. So,
Yeah, I mean, I think,
talk about that flexibility and how important that is to do these to be able to attend to these social determinants of health.
whether it's food insecurity and being able to provide meals, from fall prevention, right? We've
Yeah.
leaned into we have a fall prevention clinical program, but now we've created a like a credit debit card concept that allows seniors to buy goods for bathroom safety and home safety, to CHF and remote monitoring, and being able to provide scales and tablets to track weight and progression that way. I mean, we're in this learning phase. We've actually accelerated. We're doing more in 21 than we did in 20, right? We've learned from some of the initial programs, and we'll continue to evolve as we go forward. So, I mean, again, we feel that it's giving us the flexibility to kind of be the best we can be, and really, again, look at members holistically. So pretty excited about it.
Yeah. So you talked about your being a caregiver, but caregivers also have needs, and so talk about what you're doing in terms of what advice you'd be either giving to caregivers. I know another supplemental benefit could be some respite for caregivers, and that kind of thing. So how's that engage with the support for the caregiver?
Yeah, I mean, caregivers are becoming front and center, right? And whether it's family members like me, and quite frankly, we have to make sure caregivers take care of themselves. It can be extremely stressful. It can become all encompassing. And then obviously, being a family, if you're in a family, friends interacting with seniors, you have to also look for signs, right? Because there are signs of social isolation, depressions, a lot of sleep, lack of hygiene. These signs are important to get in front of them early. And for caregivers, right, I mean, we've put out a lot of tools and tips. For example, we just put out an ebook called Putting the Me in Medicare, and it's a whole electronic version for tips for caregivers and seniors about healthy eating, staying active, good mental health, the ways to engage during these times. There are plenty of resources about community resources that caregivers many times are the light towards, right? Because they kind of do research, they know who they are. So there's such an important part of it, but I think knowing the signs to ensure that seniors are not becoming depressed and isolated is really important as well.
Makes sense. And depending how needy the senior is, it certainly is really hard on a lot of caregivers. Seems like sometimes there's always one person in the family that takes more responsibility for mom and dad, but that's the way it goes.
I thought it was going to be like straightforward because I know a lot about healthcare, right? And just the stress of medication management, is a challenge.
Myself, it's a challenge for sure. So talk a little bit too about how you think this whole experience informs us as we move forward in healthcare more broadly. As either what do you want to see happen, or what do you hope happen, or what do you think is going to happen? But really, it's we have these conversations, and yet so much of healthcare is still not integrating these social needs with clinical care, and not integrating even the providers who do one and do the other, and that sort of interaction. It's something that is exciting within Medicare Advantage, and obviously seniors are so at risk in this situation. So that's a great place to start. But where do you see it happening, impacting Medicare more broadly, or our healthcare more generally?
Well, I think first up, kind of thinking about the whole person has got to be what we keeping at the front and center. Providers we know are so busy, right? And trying to take care of their patients in the best way they can. And sometimes the behavioral aspect and what's happening at home isn't always brought into the equation. So really thinking about sort of not just physical care, but minds and bodies are connected, and how to look at that. So I think that, this holistic view of health is going to continue to accelerate as technology accelerates, as information becomes more prominent, as it becomes easier to transfer information, and as more and more resources become available and flexible. It's sort of kind of the new way in which we have to think about holistic care. So, it's very important that we have an integrated approach to care. We've always said that, right? Medicare Advantage plans try to do that.
Right.
This aspect just sort of accelerates that view.
Yeah. Maybe one last question. Have you found it difficult to find the resources that are needed for folks? You did mention PAPA, which is kind of a newer one, and doing some really important work. And there are a number of innovations on innovative companies, and of course some of the other services are also trying to get up to speed. How do we hire the right workforce, and how do we build the resources that are needed out there? Do you have any sort of thinking about that, about how we build that, allow the innovation, bring in some of the people who've been doing this a long time, but really have the kind of assets that you need, to work with?
Yeah, I mean, I think obviously we feel there's an abundance of emerging services or companies kind of coming into the fold. Obviously, making sure that they're reliable services or reliable platforms, because a lot of this now is emerging towards technology, Congresswoman, right, is very important. But quite frankly, I think the opportunity is tremendous, right? So we are trying to vet and test and learn a lot of different avenues, right? Pop is just one. You have some of the mainstays like Sober Sneakers, which is about fitness, but they actually turned it on its head during the pandemic and doing all this virtual engagement for seniors, which has really been strong. So, and we're trying a lot of things in the food space, right? To think about, one is online interaction and coaching, digital coaching, which you'd say, wow, I'm surprised we could do that for seniors, but In Illinois, we're trying that and piloting that to traditional debit cards. So, I mean, it's just, I think technology is really going to help that. The companionship piece is important as well. So
pretty exciting. I will brag for a minute about my granddaughter who's 8, showing her 93-year-old great-grandmother how to use an iPad. Was the cutest thing ever. And she finally just drew her a picture of all the icons on her iPad and what they meant. And she hangs on to that. She thinks she should market it as an enormously important tool for her to remember which camera is which and all that. She thinks it's quite great. So, so that kind of thing is really important too. But it actually gave her a chance to engage with her great grandmother, which was really a fun thing too. So this does lead to some fun things too, but I think it is, you make some really, really important points here, and we have just a couple more minutes, but something I haven't asked you that you'd like to tell the audience, because this audience is really plans and providers and a lot of those social support groups that are doing this kind of work and want to do it and see the challenges every day, with seniors. So any other thoughts that you want to,
sure.
I haven't asked you about?
First off, I would say thank you to everyone, right? To me, seniors are the most important and vulnerable individuals we can have the honor to take care of. And whether you're a provider or a plan or someone else, that intersection with seniors is so critical. Mm-hmm. I would kind of say one last thing. We just, I would say sort of, it's funny, we lose sight of with all that goes on, that simple human connections can make a true difference, right? Mm-hmm. And during unprecedented times, you would think, that maybe that wouldn't be, but we sent these Caring for You packages, which was really about a self-support, simple self-care package to, every Medicare beneficiary at Aetna. And the amazing feedback we are getting from beneficiaries on just the appreciation and the stories has been very humbling, right? Whether it's, in these crazy times, you're a ray of sunshine for me, or we've never had enough money to buy goods at the end of the month like this. So I would just say, just remember that human connection is what makes everyone go.
Right. Well, we've heard some good stories about, even people who are doing meal delivery and just being able to see a real face and to have that conversation, even at 6 feet apart, to be able to think that someone's thinking of them is just hugely important. I guess that's something for us to think about with neighbors and just being able to, because seniors are still being advised, and this is going to go on for some time. So I suppose that's an issue too, just having people understand that this isn't over next month, and how do we deal with you're in Florida, you don't have to deal with the same, you might have to deal with hurricanes, but the weather changes.
It's a aspect, like what will happen in the fall, and that it's not just going to end and everything goes back to normal is a big challenge for seniors. I see it in my dad. He's kind of going stir crazy, right? Has more energy than he ever has. So
yeah, exactly. So they're saying, really, I can't go out. I can't go to a restaurant. I can't just take a walk in the neighborhood, or I don't know, play cards with friends. I think it's all those things.
No cards, right? They had a card thing every Thursday night. That's gone. So.
Oh, it's tough. I think it's tough for everyone, but it's certainly tough for older adults. And your point that there are also a lot of older adults out there too. With 10,000 more seniors a day, this is not going away for us as a country, as a society, as a community. So really paying attention to seniors and making sure that they have what they need. I think your advice about just thinking about a little bit of kindness or a little bit of just paying attention to someone can really just make a very big difference in their lives is just great. So
yeah, absolutely. Because think about social isolation. If you just amp up the engagement, you can avoid a lot of really negative health implications.
Right. I was thinking about the next holidays coming up. Retailers want you to think about Thanksgiving already and or Christmas. And I know it's hard to think about not bringing family together if you're lucky enough to have family. How to actually manage during those very critical times when, particularly for seniors who's like I'm Jewish, my mother-in-law said she'd never not been, not had a Rosh Hashanah dinner. Like, how do I do this? It's, but yet we figured out a way to get involved, to have her feel involved and meet that. I'm not quite sure how to make a turkey for everyone. get it around, but we're going to do our best. Well, anyway, I do want to really thank you. I think we're out of time. This has been a very easy and important conversation in a way, and really excited for what Aetna's doing and the ability to be so innovative and creative about what you do and how you do it. And obviously, you hear those stories about it, what a difference it makes in the lives of your beneficiaries. So, thank you for what you're doing, and I thank you again for Aetna and CVS Health being really just what wonderful. I was going to partners, but you're more than that for BMA and to be able to be a part of this summit. We really appreciate it.
My pleasure, Congresswoman. It was so nice to talk to you.